How to cope with an irregular menstruation cycle. Every woman has a slightly different menstrual cycle. Some women get their period every 28 days like clockwork. Others, however, might skip months, have a period that comes at different times in a month, or have a shorter or longer cycle than 28 days. 1. A missed period or irregular period can occur for a variety of reasons. Some are normal during the course of a woman's life, while others may be due to a lifestyle habit you can change or may be a sign of a medical problem that needs treatment. 2. Living with your irregular period day to day. Keep record of your menses. No matter how long, short, or bizarrely timed your periods are, keep track of when they come and go. Use a notebook, an online calendar, or one of the many apps for your phone made for this reason. Periods that seem entirely random might, if you can look back, show some pattern you can use to predict the next one. Use birth control consistently. Since you're not getting your period every month informing you a baby isn't on the way, ensure your pregnancy status with other methods. Always practice safe sex, but when in doubt take a pregnancy test 4 weeks after your last period started. Talk to your gynecologist about the birth control pill or other contraception. Definitely do not use the timing method of birth control. This can be a difficult practice to get right for those with regular periods, and with an irregular period your ovulation can be very hard to predict. Be prepared. If you don't know when your period is coming, it's best always to be ready for it. Make a small survival kit for yourself to keep in your car, your office desk, or your purse. Include panty liners, pads, tampons ranging from light to heavy or your own preferred product, and ibuprofen or Midol for cramps. Now you'll be ready for anything. Recognizing normal causes. Wait to get regular if you just started menstruating. It can take a few years from the time a girl gets her first period for her body to develop a regular cycle. Even then, what's regular varies. Girls' cycles can range from 21 to 35 days. 3. Don't stress if your first few years of periods aren't very regular, they might even out with time. Take a pregnancy test. If you're sexually active and miss a period, you might be pregnant. Pregnancy is the most common cause of a missed period. You can get a test at the drugstore that's very accurate, or see your family doctor. Consider hormonal changes related to reproduction. If you're breastfeeding, you won't have your period. You'll also miss several cycles if you recently gave birth or had a miscarriage. If you're not breastfeeding, you will probably get your period again anytime between 5 weeks and 3 months after giving birth. 4. Ask your obgyn about your birth control method. Some birth control pills cause you to not have periods. Even after stopping the pill, it can take some time to start getting your period again. Birth control methods that are injected or implanted and some IDs can also inhibit periods. 5. Consider menopause. Menopause is the time when women's bodies start making lower amounts of hormones, ending the time she can have children and causing periods to stop. Menopause usually begins around age 50, but for some women menopause can start and periods can stop by age 40. 6. Don't stress if you just missed 1 month and you're not pregnant. It's not uncommon for a woman to have what's called an anovulatory cycle, which is just a month when your body skips ovulation and thus skips your period. This is frequently the cause of a missed period and is considered normal if it occurs only once or twice a year. 7. If you miss a period during a time when you are very stressed, keep in mind that it is a common occurrence and try not to worry about it. Fixing lifestyle causes. Be at your ideal weight. Significant weight gain or loss, as well as being underweight or overweight, can cause problems with ovulation and irregular periods. Gaining weight if you're underweight, or losing weight if you're overweight, will often help with fertility and get your period back on track. 8. Eating disorders, especially anorexia, can cause extremely low body weight, about 10% under normal weight, which messes with hormones and can stop periods. 9. Eating disorders are seriously illnesses that can really harm your body. If you have concerns about your eating habits, talk to a parent, friend or doctor for help. Exercise moderately. Getting a moderate amount of exercise is not only good for your health, it can help to regulate your periods. Overexercising, however, can cause you to be underweight or decrease your body fat so much that you can't ovulate. Increasing or decreasing your level of exercise to hit that appropriate middle mark can help regulate your period. 10. Girls who do activities that require intense training, like ballet or gymnastics, might have irregular periods or no periods at all. 11. As long as you see your doctor to make sure you're getting all the nutrition you need, it's okay. Eat healthy. Foods that are high in fats, carbohydrates, and processed ingredients can cause all sorts of changes in the body, including irregular periods. Eating a whole food diet, one based on foods you cook or prepare, is the best option for overall body and menstrual health. 12. Reducing the amount of refined carbs you eat and getting the right servings of fruits, vegetables and dairy can help a lot. Supplement nutritional gaps with quality multivitamins that include calcium and magnesium, and a fish oil supplement. 13. Minimize the coffee and soda. Caffeine can cause many negative effects on the body, and some studies show that self-reported habitual caffeine use might be linked to various changes in the period cycle. 14. Specifically, caffeine can cause a shortened cycle, that is more frequent periods. 15. Women with irregular periods are advised to stay away from caffeine as much as possible. 16. Decrease your alcohol intake. Estrogen and progesterone are the two most important hormones that regulate ovulation and your period. Drinking a lot of alcohol can interfere with how your liver works with those hormones, causing problems with menstruation and many other physical issues. 17. Relax. Stress plays a huge role in the menstrual cycle because stress actually affects hormones. The more stressed you feel on a daily basis, the more likely you are to throw off your cycle. 18. Practice relaxation and stress coping techniques like yoga, meditation, exercise, or a nice bubble bath. Periods usually regulate once stress decreases. If you're going through a major life change like switching jobs, getting married or divorced, or moving, the increased stress might mess with your cycle. Make a mental note of the stress and change, and work on calming techniques. 19.